In health news, measles are making a comeback. Cases reported in at least 17 states. The CDC issued a caution alert on a disease that's back after going away 24 years ago. Joining me now to discuss it is our medical expert, Dr. David Winter from Baylor Scott & White Health. Good morning, Dr. Winter.
Good morning. Good to be with you.
The first question we have for you, because when we hear something like this, it's pretty scary, is what this alert is all about and whether or not we need to be concerned.
I think we do. We've seen cases of measles in this country go up 3 times this year compared to last year. And measles is one of the most contagious viruses on the planet. It said if somebody has measles and walks through a room full of kids that are unprotected, unvaccinated, 90% of those kids will get the disease. 1 out of 5 will have to be hospitalized for severe illness, and a couple may even die. The good news is the vaccines work extremely well. Children that are vaccinated won't get sick, and they have lifelong immunity, Morgan.
And I think a big question a lot of people have, especially when we talk about how long it's been really since this has been a buzzword for us, is why we are seeing this spike right now. Are people just not getting that vaccine?
Yeah, that's exactly right. If you look back 1999 and 2000, those 2 years, measles was declared to be eliminated in this country. Very successful vaccine program. Right now it's laxed. We don't give as many vaccines to kids. We're seeing spikes in New York City, Chicago, Philadelphia, many states, as you said, not quite yet in Texas, but they're coming at us. So we need to talk to our kids about getting vaccines. Very important.
And when we're having those important conversations, can you talk to me about signs and symptoms of measles?
Yeah, measles typically starts with fever, runny nose, and a cough. Then you get some white spots up in the mouth, the sclera, the white part of your eye, that turns red. Next step is a big red blotchy rash on the forehead, and it sprinkles down then the little red dots all over the body. Now, if you really get sick, it'll go in the lungs. That's measles pneumonia, or go to the brain. That's measles encephalitis, very bad diseases. So we need to pay attention to this right now because it's coming back, and we need to take care of things. Antibiotics don't work. There's no good treatment. Prevention is the best tactic.
And so that kind of brings us back to where I wanted to circle back with you for our final question, and it is about the measles vaccine. You know, can you talk to me about the safety of it? And you've already kind of spoken to how effective it is, but we'd just love to hammer home that point about how effective that vaccine is.
Yeah, it's very safe. The vaccine was invented in the 1960s, goes back a long way. You might get a sore arm or so, but that's about it. Let me also add that adults typically don't need this. If you had measles or a vaccine when you were young, you have lifelong immunity. If there's a question, a blood test can look for antibodies. But kids are the ones that are lacking. They're very vulnerable. This disease is very contagious. If your child is not vaccinated, be careful because they can get measles and it can be a very, very bad disease.
Really helpful information, Dr. Winter. Thank you so much for taking time to make us a bit smarter about our health.
Thank you, Morgan. Have a good day.
You too.